And we're back again at ViVE with the Reverse Mullet Healthcare Podcast from BP2. I'm Dave Pavlik.
And I'm Ellen Brown, and we are the two of the three co-hosts. Our third is at home having serious FOMO now. Shout out to Justin.
Exactly.
So.
And now today we have the pleasure of speaking with Dr. Geoffrey Rutledge and Craig Hiddle of HealthTap.
Yes. So
really great to have you guys.
We know Craig from past ventures. And so when I reached out, I thought, I bet Craig's going to be at ViVE.
Yeah.
And I wanted to connect anyways. And we still haven't had time to connect offline, but I'm glad that we got to connect.
Likewise. Pleasure to be here.
So
Thanks for having us.
Tell us about what you're doing and why you're here at ViVE. And then we'll ask you the fun question we get to ask.
Yeah, amazing. So I'm the Chief Commercial Officer at HealthTap. And, our goal, our mission as a company is to put affordable, accessible, high quality healthcare at the fingertips of every American, right? I mean, everyone knows the challenges of affordability and just lack of, PCPs and the economics are out of control. And we've set out to change all that. And we firmly believe that one of the keys of providing the right kind of, and really the only sustainable kind of economics long-term is by virtual first primary care and empowering members to actually partner with their provider in a longitudinal way to really take control of their own healthcare, and then obviously rely on the expertise of doctors to help them in that journey. So it's an exciting journey. We've been around for about 14 years. Dr. Rutledge is one of our co-founders. So we have a little fun.
You said that really well.
Thank you.
Good job.
Did he miss anything?
Well, we started the company 14 years ago with the vision of bringing healthcare to mobile devices. And it's been a delight and an amazing journey to build this platform that over the past more than a decade has been refined to the point that it actually works incredibly smoothly now. At the same time, we discovered that it's not just healthcare, but primary care, which is, by the way, people are beginning to recognize how important primary care is, and there isn't enough of it. And it's also a problem for primary care doctors who cannot practice the kind of medicine they want in the system that we have.
Absolutely.
And the amazing thing about the virtual platform is that it gives the doctors time and ability to connect with patients in a way that they don't actually do in the office.
Well, the word connection is just missing.
And how many people have a good, solid relationship with a primary care doctor they trust, someone that they would turn to when they have a question or concern or don't know what to do? And we're enabling that because on our platform, you get to pick your own doctor. You see them. You can look at the video. You can see where they trained, how long they've been in practice, where do they live, what do they like to do. And is that the kind of person you want to be, have as your doctor that you trust?
Yeah.
And different people choose different kinds of doctors.
Yeah. And it's so different from the typical transactional virtual care that's out there, right? Telemedicine's not a new thing, obviously.
Right.
Virtual care is not a new thing.
Right.
We would argue, well, we were around before COVID, right? It didn't take a pandemic for us to really say, hey, this virtual first primary care model, that's where it's at. We were purpose-built around that whole function to begin with. And so I think what Dr. Rutledge is talking about in terms of that longevity, that longitudinal relationship, that's really the key. And I think one of the things hopefully we get to talk about in this podcast is some real change in terms of the rise of consumerism, the rise of the patient to be able to make better, more informed decisions on who they partner with for their clinical care, how they pay for their clinical care. Everyone just has kind of plugged into the system for so long. I get my insurance from Medicare or my employer. And I mean, everyone sees the cost curve continues to spiral out of control. We got to do something about that.
Yeah.
And what's been shown is that people that have a primary care doctor get better health care. They have higher level of preventive health services. They live longer. When you have a primary care doctor, you live longer. It's really quite astonishing.
But what percentage of people have a primary care?
And you spend less on healthcare. And you spend less on healthcare.
But again, that's you're defining the transition we need to make, which is from sick care to health care. So you're defining a core component of healthcare.
In order to be healthy, you need a guide.
You do need a guide.
A good doctor who knows you, understands your preferences and your approach to life, can give you guidance about how you can lead a healthier life.
And is willing to connect with you and guide you because that's is set in a system for success.
And they can steer you away from things that are expensive and don't work.
Yeah.
And toward the common, simple things
Dave's ready to sign up.
You can do to have a healthier life.
Dave's like, wait, where?
No. I want to know the answer to Craig's question. I mean, you started to ask what percentage of people have primary care.
Yeah, I mean, actually, most people think they have a primary care doctor, but they really don't. And in fact, my wife, personal story, she doesn't have a primary care doctor anymore because her primary care doctor fired her because she hadn't seen her in the last 24 months, right? So providers are, I mean, they're under such a time crunch and they've got to continue to turn the wheel, that if you don't come back and see them, they'll actually fire you from their practice. Like what kind of law?
So it's a low percentage.
Yeah, it's
on
probably
the order.
I would say 30-35%.
30% of the number I was going to use.
Ding, ding,
That blows me away. That blows me away. I thought everybody had a primary care.
Well, but people will have a doctor that they've seen, and some people will see a specialist for a specialty problem, and they'll say, well, that's my doctor, but the doctor's not paying attention to their entire spectrum of health issues.
Yeah, good point.
Because they're necessarily, as a specialist,
they're not the
focused.
primary care.
Now, the really good ones will do some
Sure.
good primary care, but a lot of people are missing out on the things that are needed to maintain a healthy life. And the amazing thing is the virtual technology enables people to get this no matter where they are. And if the doctor is available more conveniently, then it's easier to get to them. So people use it more. They're lowering the barrier for
It's
access.
friction, right? And however much friction you can take out of the system.
The other really cool thing we do is once you meet your doctor, we let you text your doctor. And it goes not to a nurse practitioner or a customer support representative. It goes to the doctor. When you text your doctor, it's a message that appears on their machine. They look at and respond to you directly. And the person who's responding to your text is someone who knows you. And that is a wonderful glue for
I would,
gaining access to
I might get fired
good
from my
care.
doctor, though, if I could send them it.
So are your customers the practices, the health systems?
Yeah, so we are a medical practice, right? So we are licensed
health plans?
in all 50 states. Health plans, self-insured employers, accountable core at-risk provider organizations. So we can be considered like,
done my research.
a subcontractor of an ACO, for example. That's like, they've got
but that's a question anybody would have asked.
No, it's fair. It's fair. For
Also,
sure.
don't forget, we have a direct-to-consumer offering. We're the least expensive for people that don't have or are underinsured. If you have a high deductible,
which is I think like half of the commercial population
it's
now,
a
if
lot.
not more.
So you're paying all of your routine care unless
Exactly.
something goes really bad.
that's me.
We are the most efficient and effective way for someone who's paying for their health care to actually get access to a wonderful doctor. One of the challenges primary care doctors have in the corporate world is they're often pressured to spend less time with each patient and to quickly make a referral
Absolutely.
or to order a test.
Right.
And they're pressured and incentivized to do that. Our doctors we've selected as ones that want to build relationships with their patients, and we give them enough time to do so. The first visit with a doctor in HealthTap is always a half an hour if you schedule the visit. Not if you want to do an urgent care right off, immediate doctor who's the next first doctor. And we're very proud of the fact urgent care clinic has doctors that answer within 1 minute. Our median answer time is like 45 seconds. It's great.
Wow.
So you can get that. That's a shorter visit, and that's available. But if you have a doctor that you know, then schedule a visit. Usually it's available same day, almost always same week.
That's amazing. Absolutely
Good
amazing.
idea.
Okay, so let's ask the question. So we will start with Craig. What do you think could affect real, all caps, change in healthcare?
All caps.
All caps.
Real.
Yeah. And I know we all have
Not
to
fake.
do the incremental work. Like I get it. But so you know me, I'm
Yep.
crazy. And so fixing the food system is one of my biggest things because I feel like unless we fix our broken food system, people are never going to be able to get healthy because they don't have access or knowledge or any of that. So I
Yep.
say that for context that you can go far here
Go
and not
big.
be considered crazy.
No, food is medicine is a real thing. I think it's a great place to
Food
start.
is health.
Food is health. Health
Sorry.
and medicine. No, it's
I'm
great.
such a pain.
No, I love it. I know. Okay.
You know me though, you know. So.
All good. So I think the rise, I mentioned it earlier, but I think the rise of consumerism, and if you just look at the trends, I'm an economics guy. Like, I went to business school and I'm like, I got it. I'm kind of
Did
a
you
numbers
major in
nerd.
economics?
Finance.
Okay,
Finance.
see, I'm finance and economics.
So, actually,
So I
I'm
love-
not really an economics guy. I'm a finance guy.
Yeah,
but I
this is close enough.
love the numbers, right? So anyone, we all know that the cost curve is unsustainable. And if you look at employer-sponsored coverage, which I think is about half the country, probably 150 million people get their health insurance through employers, and
Right.
employers are having to deal with this premium increase every single year. This year,
Yeah.
I think it tripled in 2024 from where it was in 2022. I mean, it's always been that way. And at some point, there's going to be a bubble. Like something's going to have to happen where the employer is going to say, we can't deal with this.
We
anymore.
had Mike Barrett, who used to be at Centene from CHS. So we had him on for an episode as a guest, and his hypothesis, his answer to the change question was he called it Consumer Direct 2.0, and he is convinced that like any moment now, employers are going to be like, I'm done. I'm not doing this anymore. You will go get your own health insurance.
Well, Mike stole my answer because that's amazing.
Oh, darn it. Sorry.
No, but a different take on it, though, is, I do think that, yes, eventually employers are going to say, look, it's going to be more of a defined benefit plan type thing.
Right.
We're going to give you $1,000 a month. We'll underwrite a catastrophic plan for you for that type of stuff. But as consumers become more savvy and there's more digital access and more savviness in terms of like how to shop for healthcare the right way and to talk to doctors that they really can build that relationship with that helps keep them healthy over the long term, I really think that has to happen and will happen. I would suggest, I don't know the time frame, I would think the next 10 to 15 years.
So I'm very aligned with you. As I always, when people, this is, I call it the plane conversation. You're on the plane and what do you do? What do you do, right? I'm in healthcare. Oh my gosh, it's so broken. Is it ever going to get fixed? And I'm like, well, how? And then the question is, how are we going to fix it? What would you do to fix it? This is what I get asked all, people ask me this. And I always say it's complicated because the person consuming the healthcare doesn't even make their own choice about what they're getting. Their employer is doing that. So I always say until you remove that middleman, right?
And there's no other industry, I challenge anyone. I mean, what other industry can you think of where as a consumer, you literally have no idea what the cost of that product or service is? And
you don't have the cost, or you're like...
Because that's, you say that all the time.
Yeah, not only that, not only do you not have an idea of the cost of the benefit plan, you also can't even get a friggin' quote for what you're having done.
Right.
This drives me crazy.
Right.
Now it's even worse than that because you don't know what it is that you need. And so how do you evaluate the cost of the thing, which you're trying to figure out the cost of it, if you don't even know if you need it, let alone want it?
But I'll challenge you and say, there's been many times when I know what I need.
Sure.
Where somebody has said to me, this is what you have to go get done. And I happen to have a high deductible plan. And I call and say, what is this going to cost me? Because this is me. I'm paying for this, right? I don't know. What do you mean you don't know? Well, we have to see what your insurance will pay. Well, if I tell you what my insurance is, can't you? Nope, I can't. We have to process the claim. I'm like, what auto body shop do you go into and say, I need a new carburetor? Well, that's great. We'll do that for you and let you know at the end.
Right.
When it's done.
Right.
I'm sorry.
Yep.
Right? So I'm sorry. I'm stealing your thunder.
No, and it's still 20% of our GDP, right? I mean, we wonder why we spend so much on healthcare.
Yeah, so I'd like to kind of suggest there's really two sides. It's really two questions, not one. Right?
Okay. All right.
Because there's the how do you fix the sick care system, and how do you generate a society in which people are behaving in a way that they're healthier? And food as medicine is one element of that, but there's a whole variety of things we know if people did, we would all be healthier.
I
look at the crisis of the obesity is sort of a manifestation, a symptom of how severe the issue is. And it's a bigger societal issue about education and focus on health and well-being. Separately, we also need to fix our sick care system to make it more accessible, more affordable, and more able to deliver the things that are known to work.
Yep.
Right. We have a whole set of things that we know, if done consistently, will actually help people a lot. That's why people that have a primary care doctor live longer.
Absolutely. But if we had a sick care system that was, we could talk. Okay, I'm going to stop.
So I would suggest
we need a follow-up episode, but I want you to.
Virtual technology and integration of intelligent systems is going to be a huge component in delivering better and more efficient and more accessible care. If you look at what we're doing right now, we're leading the way, showing what can be done. So for example, when you schedule a visit on HealthTap, we ask you to do a pre-visit interview, and we have an AI conduct a dynamic interactive interview with you to collect all the routine information the doctor would do in the first 10 minutes of the visit. And then it writes the note for the doctor. When your visit starts, the doctor reads the note and you just save 10 minutes of time, which the doctor can now give you, talking about things like impediments to care, other issues that are going on in your life, the things the doctors wish they had the time to get to that they often don't because they spend all the allocated time just figuring out what the problem is.
Is there good adoption for that? The patients are doing that?
It's wonderful to see. And when they do it, like 95% of the time, the information is helpful to the doctor. Yeah. And when the doctor sees it, more than half the time, they just copy paste the note in as a foundation for the note they actually write. And when I did the analysis to show that actually this AI is so smart that based on its interview, it can figure out what the patient has. The differential diagnosis that the AI generates matches what the doctors actually put on the chart.
Impressive.
88% of the time.
Yeah, I definitely hear at ViVE, we've gone to some talks and I have definitely been swayed a little bit further that AI isn't just a shiny object because
what we're going to see is intelligent integration to improve workflow. We're going to see the things that can be done in an automated way should be.
Yes.
And the doctor should be relegated to the role of integrating and understanding and evaluating the preferences and assessing how the patient will respond and what's the right thing for them to
Yep.
do, with a foundation of accuracy in diagnosis
Yep.
and decision making.
And
in the first
removing a
place.
lot of the administrative friction that they face and just
That too.
the stress and pressure that's put on them. And yeah, so we appreciate you guys coming in and bringing I mean, we just had a health system CIO come in, and she was talking about the importance of virtual. So I appreciate you all bringing a delivery model that is solving a problem in the industry of a shortage of a very important and needed part. Really, it is the quarterback of our healthcare system, and creating a solution. So I commend you, Dr. Rutledge, for what you have accomplished, and I appreciate you guys taking some time
Super
to
impressive.
come and talk to us. Yeah.
This
So
is
thank
also
you.
to get you to come back for full episodes.
Yeah, so we can have a
Sign us up.
Yeah.
No,
We
thank you,
appreciate
Ellen.
it.
Thanks,
All right.
Dave.
Wonderful meeting you.
Thank you
Pleasure.
very much.
Thank you, guys.
Appreciate it, guys.